how I'm going to do the PSM. So first I'm going to start about the various type of national health program. Then I'm going for communicable disease. In the national health program, I'm going to do national vector-borne disease control program, then national tuberculosis elimination program, national AIDS control program, a national leprosy elimination program, and the program which is there for blindness. I'm going to do this blindness for OPHEL as well as from PSM. And the one biggest is the national vector-borne disease control program because it has like 6 diseases. In the 6 diseases, like it includes the malaria, dengue, Japanese encephalitis, lymphatic filariasis, kala azar, and chikungunya. I'm going to do the malaria and dengue because these are asked in the case exam. These I'm not going to do now because it is really going after exam we can do, but these two I'm going to complete. I'm going to read it from Marrow notes. After that, I am going to reading from some topic which is Spark. I am not going to use ARPIT because the national health program which is given in ARPIT are like it is past or it is not updated. So I am going to use only these two things for a national health program as well as for communicable disease. So these things I am going to read only from the Marrow notes as well as the some topic from Spark. I completed the National Vector-Borne Disease Control Program. And how will I going to write that? The point number 1 is about the 6 diseases which is involved in this condition. Okay, malaria, dengue, chikungunya, lymphatic filaria, Japanese encephalitis, and kala azar. These are the 6 Ds which is involved. The first one is the malaria. In the malaria, the point number 1 is about the micro portion, micrology, like HIM. What is the host, infective form, mode of transmission, what is life cycle. The point number 2 is about epidemiological determinant, which is the host, agent, and environment. And the third portion is about the early diagnosis, which include two methods, mainly the rapid diagnostic kit and peripheral blood smear, which is investigation of choice. Then in the treatment and the chemoprophylaxis. Chemoprophylaxis, these are for malaria. Mainly in any health disease program, there are 4 points that I remember. The one is indicator. What is the strategy of that program? The organization, and what is the objective of that program. 4 things are there, like in the indication. In the malaria, there are annual blood parasite index, annual blood examination rate, annual parasitic index, and slight positivity rate in the case of microfilaria, in the case of Japanese malaria. So I just want to talk some about the treatment of malaria, that in how I remember the treatment. The first thing that you have to remember is it is sensitive or resistance. If it is sensitive, means if it is chloroquine sensitive, then we have to use chloroquine and primaquine. If it is resistance, then there are 2 options. One is artemisinin combination therapy, and the second option is quinine plus 3. 3 means tetracycline, doxycycline, and clindamycin. You can use any one of drug with quinine. This is second option. So the case number 1 is if there is a Plasmodium vivax infection which is sensitive, then we have to use chloroquine plus primaquine. Chloroquine for 3 days, primaquine for 14 days. The case number 2, the Plasmodium vivax which is resistance, or if it is the Plasmodium falciparum infection. Falciparum is like most always resistance to chloroquine. So in this condition, we have to use ACT, or we can use quinine plus 3, any one of drug from 3.
And the case number 3 is the emergency condition, means it is severe malaria, or we can say it is cerebral malaria, in which we can use IV quinine or IV artesunate. This is in normal population. If it is in the pregnancy, then we use chloroquine only. Primaquine is given postpartum because the primaquine is contraindicated in pregnancy. If it is like resistance, then in the first trimester we use only quinine plus we use clindamycin, because these are also resistance in pregnancy. Okay, so these two, and the one is means contraindicated in pregnancy. So in the first trimester we use quinine and clindamycin. In the second and third trimester we can use artemisinin combination therapy. And if it is severe, then we prefer IV quinine in pregnancy. IV artesunate can be given, but mainly the IV quinine is preferred. What's about artemisinin? Okay, so this is basic that you have to remember. So what is the dose? So in case number 1, there is day 1, 2 and 3. On day 1, 10 milligram per kg chloroquine. Day 2, 10 milligram per kg chloroquine. Day 3, 5 milligram per kg chloroquine. It is given for day 3, and primaquine is given for 14 days. Okay, dose is 0.25 milligram per kg. In case 2, there are artemisinin combination therapy. There are two therapy. One is artemisinin plus pyrimethamine plus sulfadoxine, or if the case is from the northeastern India, then we use artemether plus lumefantrine. This is a fixed dose combination. So 4 tablet given BD for 3 days. In case of artemisinin combination therapy, artesunate pyrimethamine and sulfadoxine, day 1 we give artesunate plus pyrimethamine plus sulfadoxine. On day 2 we give artesunate plus primaquine single dose, not pyrimethamine, primaquine. On day 3 we only use artesunate. So it is a 3-day, it is also a 3-day therapy. And in the case of severe malaria or severe complicated malaria, we use IV quinine as IV artesunate. So this is a treatment that you can write. In case of chemoprophylaxis, if it is short term, then we use doxycycline, and if it is long term, then we use mefloquine. Mefloquine is given weekly, it is given daily,